Testing the dairy diabetes theory. In a pilot study, researchers in Finland, Sweden, and Estonia identified 242 newborns at risk for developing type 1 diabetes. Each had a first-degree relative with the condition. The researchers then encouraged their mothers to breastfeed. When mothers were ready to wean their infants, the researchers asked half to use a specially modified baby formula in which dairy proteins were broken up into individual amino acids, protein building blocks that are too small to elicit an immune reaction. The other families were allowed to use a regular cow's milk formula. The research aimed to see whether avoiding exposure to intact cow's milk proteins could reduce the likelihood of developing diabetes. As the years went by, the researchers found that the children who were fed the special formula were much less likely to develop the dangerous antibodies. In fact, the risk of developing antibodies to their insulin-producing cells was cut by 62%. The study was small, only a pilot trial, but it did follow most of the children through their first 6 to 8 years of life. During those years, several children developed diabetes. Of those receiving unmodified formula, 8 developed the disease, and in the modified formula group, 5 developed it. As it turned out, 2 of those 5 had dropped out of the study right at the start and never actually received the modified formula. That meant that only 3 children in the modified formula group developed diabetes compared to 8 in the regular formula group. The study suggested that the cow's milk theory may well be part of the puzzle, but it was too small to be definitive, and the research team began a much larger test in 2002 involving families in 15 countries. There were some limitations to this pilot study. First, it restricted dairy consumption only during the first several months of life. It is not clear whether later exposure, say at 8 or 9 months of age, might put some children at risk as well. After all, it has long been known that very large dairy protein molecules can sometimes pass from the digestive tract into the bloodstream, even in adults. The study did not address whether exposure to dairy proteins could trigger type 1 diabetes in children who are beyond early infancy. Second, the study did not ask breastfeeding mothers to avoid cow's milk in their own diets. Many breastfeeding women noticed that their children are sometimes affected by what they, the mothers, have eaten. Specifically, if a mother eats certain foods, her baby becomes colicky, crying inconsolably, as if suffering from a terrible stomachache. One of the leading suspect foods is dairy products. When breastfeeding women avoid consuming dairy products, their babies often improve. For some women and their babies, it makes an enormous difference. In 1991, researchers found that some cow's milk proteins ingested by a nursing mother ended up in her breast milk. They came from her digestive tract, were absorbed into her bloodstream, and found their way into the breast milk. Thus, in order to avoid exposing babies to dairy proteins, it is important to eliminate them not only from infants' diets but also from the diets of their breastfeeding mothers. One last caution about this study. It did not actually exclude dairy products from the children's diets. Rather, it used a milk product treated to break up the dairy proteins. If anything in milk other than these proteins contributes to the problem, this study would not have been able to detect it. Even so, it was an important step in coming to understand how parts of an infant's diet may lead to diabetes. The study illuminated other contributors to diabetes too. Prior evidence had suggested that viral infections may play a role, and indeed, viruses appear to have done so for some infants in the milk study. Specifically, viruses seem to stimulate immune cells, perhaps making them more active against cow's milk proteins than they would normally be. Or cow's milk proteins may influence the course of viral infections in some way. The idea is that the interplay between cow's milk formula and viruses may put babies at increased risk. No one knows what the research on milk and type 1 diabetes will ultimately show. If the theory turns out to be correct, it suggests that avoiding cow's milk products, at least during the first several months of life, could greatly reduce the likelihood of developing this disease. Needless to say, breastfeeding instead of feeding formula poses no risks for children. Quite the opposite. breastfed babies gain many advantages, including better overall health and even a few extra IQ points compared to their formula-fed counterparts. And the most healthful breastfeeding is done when mothers follow a diet free of foods that can harm their babies. Other risk factors for diabetes may yet emerge in research studies, and for children who are already in the midst of an antibody attack, researchers are studying means of intervening to try to stop the destruction of their insulin-producing cells. Staying healthy. If we are able to prevent diabetes, we will have a very powerful tool at our disposal. For people who already have type 1 diabetes, there are effective steps they can take to help them stay healthy. Keeping blood glucose under control is essential, and stabilizing cholesterol levels and blood pressure protects the heart and blood vessels. The same sort of diet that is described in this book for type 2 diabetes is likely to be enormously beneficial for people with type 1 as well. Part 2. The Program. Chapter 4. A Powerful New Menu. We are setting our sights on a dramatically better result than previous diets could deliver, a result that's possible through a new approach to eating that I will explain in this chapter. If you have type 2 diabetes, you do not want to cater to insulin resistance, you want to counteract it. If you have type 1 diabetes, you want to get your blood sugar under good control, minimize your medications, and stay in good health. This chapter will show you the principles of revolutionizing your menu. Then, in the following chapters, I will show you how to put them to work as you plan your meals. For type 2 diabetes, our goal is to clean the gum out of the locks. As you recall, the fundamental problem in type 2 diabetes appears to be the accumulation of tiny amounts of fat inside muscle cells. They make it hard for insulin to do its job by blocking what is called insulin signaling. That is, they interfere with the process by which insulin opens the cell membrane to allow glucose to enter. You need to select foods that reverse this process. A diet revamp can also help protect your body from the disease process. This is crucial for both type 1 and type 2 diabetes. As you will see, these diet changes are far-reaching and powerful. You may also find, as many of our study participants did, that learning the plan's guidelines is a simple process. There are no limits on portions, calories, or carbohydrates. You will focus on what you eat, so how much you eat generally takes care of itself. But we are getting ahead of ourselves. Let's first look at the menu changes that make the diet so effective. Then, in the following chapter, I will walk you through various ways to adopt them to make this diet doable for you. To reverse the course of diabetes, clean the gum out of the locks, and allow the heart and blood vessels the best chance of reversing any existing blockages, there are 3 guidelines. 1. Set aside animal products. 2. Keep vegetable oils to a minimum. And 3. Favor foods with a low glycemic index. Now, there's no need to panic. I know this sounds like a tall order. I am going to walk you through each step to show you the whys and hows. For now, I just want you to understand the principles. 1. Set aside animal products. There are 2 possible sources of fat in the diet: animal products and vegetable oils. This guideline tackles the first of these. Needless to say, if you are not eating beef, you will not get any beef fat. If you are not eating chicken, you will not get any chicken fat. Following this guideline means purging the animal fat from your diet. The program you are about to start omits meat, dairy products, and eggs. As you learned in Chapter 2, researchers who measured the fat inside the muscle cells of people on high-fat diets showed that the fat you eat can rapidly increase the amount of fat in your cells. Exactly the opposite happens in people who avoid animal products. As you recall, people following a vegan diet had 31% less intracellular fat compared with people on a regular diet. That means improved insulin sensitivity. That is a great start, and the next guidelines are designed to carry you further. You will get another benefit. When you set aside animal products, you do more than free yourself from animal fat. Since animal products are the only source of cholesterol in the diet, leaving them off your plate also eliminates all the cholesterol from your diet. As your cells reclaim their health, the rest of your body does too. Instead of eggs and bacon for breakfast, you might have a big bowl of old-fashioned oatmeal with cinnamon or blueberries, half a cantaloupe, and some rye toast. Perhaps you might add some veggie sausage or veggie bacon. For lunch, instead of, say, meat chili, you might have veggie chili or hearty lentil soup. If you generally go for a burger, you might choose a veggie burger. If you have dinner at an Italian restaurant, you might have spaghetti with tomato sauce and fresh basil. At a Mexican restaurant, you would skip the meat taco in favor of a bean burrito. Hold the cheese. At a Chinese restaurant, you could have your pick of the many vegetable dishes on a bed of rice. At this point, you may be thinking, spaghetti? Rice? Am I allowed to have these carbohydrate-rich foods? The answer is yes. Now, I know that people with diabetes have heard over and over that they must limit rice, pasta, and other starchy foods. But keep in mind that diabetes and overweight has been rare in countries that have made these foods their staples. The plan does have rules about carbohydrates, but they relate mainly to which ones you choose, not how much. In our studies, we have found that people who include plenty of healthy carbohydrates in their diets do better, not worse. I can understand omitting beef, you may say, but why eliminate chicken and fish? Well, the nutritional makeup of these foods may surprise you. They have significant amounts of fat and cholesterol, and they lack the fiber and healthy carbohydrate you need. Chicken, of course, is where chicken fat comes from. Even if you strip away the skin and eat only white meat, about 23% of the calories come from fat. Much of that fat is the bad form, saturated fat, the kind that pushes your cholesterol upward and worsens insulin resistance. Fish vary. Some types are lower in fat than chicken, while others, such as salmon, are quite high. But all fish have fat, and much of it, between 15 and 30%, is saturated fat. All fish have cholesterol, too. Some, such as shrimp and lobster, are much higher in cholesterol, ounce for ounce, than steak. What a difference! Animal versus plant foods. Animal foods. Beef, bottom round, lean. Fat, 37% of calories. Cholesterol, 86 milligrams. Chicken, white meat, skinless. Fat, 23% of calories. Cholesterol, 85 milligrams. Pork loin, lean. Fat, 41% of calories. Cholesterol, 81 milligrams. Salmon, Atlantic. Fat, 40% of calories. Cholesterol, 71 milligrams. Trout, rainbow. Fat, 35%. Cholesterol, 69 milligrams. Tuna, white. Fat, 21%. Cholesterol, 42 milligrams. Meat servings are 3.5 ounces, 100 grams. Plant foods. Beans, navy. Fat, 4% of calories. Cholesterol, none. Broccoli. Fat, 11% of calories. No cholesterol. Lentils. Fat, 3% of calories. No cholesterol. Apple. Fat, 3% of calories. No cholesterol. Orange. Fat, 4% of calories. No cholesterol. Rice, brown. Fat, 7% of calories. No cholesterol. Of course, some people eat fish precisely because it has fat in it. That is, a portion of the fat in fish is in the omega-3 form. Omega-3 fats are reputed to reduce inflammation and block the formation of blood clots that could lead to heart attacks. There is increasing evidence, however, that omega-3s are no panacea. In a recent British Medical Journal article, a team of British researchers reported the results of a meta-analysis, that is, a large study combining all the prior studies on omega-3s and health. Looking at 89 prior studies, the researchers found that whether omega-3 oils were consumed in fish or as supplements, they offered no significant protection against cardiovascular disease, cancer, or risk of death. Could the supposed benefits of omega-3s be just a fish story? Well, it is important to remember that fish fats are mixtures, just as all fats are. Fish oils do indeed contain some omega-3 fat, but they also contain plenty of saturated fat. As noted, from 15 to 30% of the fat in fish is plain old saturated fat. That's less than in beef, about 50%, or chicken, about 30%, but it is considerably more than you need. There is no specific need for saturated fat in your diet at all. Finally, if you are looking to lose weight, it is important to note that good fats pack in just as many calories as bad fats. That is to say, omega-3s are every bit as fattening as any other fat or oil. In studies, chicken and fish diets are routinely disappointing. When researchers test diets that include even modest amounts of chicken and fish for their effect on cholesterol, they find that these foods reduce bad, low-density lipoprotein, LDL, cholesterol by only about 5% compared to an unrestricted diet. LDL cholesterol is the kind that increases the risk of heart problems. Much more effective are diets that eliminate animal products altogether. Our most recent study using this sort of diet cut LDL cholesterol by more than 20%. That's 4 times better than the chicken and fish approach. Now, you will notice that the diet I recommend is not just free of animal fat, it is also free of animal protein. That is important because animal protein can harm the kidneys, and protecting them is a key goal. Protein from plant sources is the way to go. If life without chicken or cheese sounds challenging, take heart from the experiences of the folks who participated in our research. They found the transition to be smooth, and within a few weeks they were very much in charge, not only of their menus, but also of their health. They found that excess weight was already starting to melt away, their blood sugar was coming under control, their cholesterol levels were falling, and very soon many started to cut back on or even discontinue their medications. Ready for a change. In our most recent research study, half the volunteers were assigned to a low-fat vegan diet, and the other half were instructed to follow a diet based on American Diabetes Association, ADA, guidelines. Since it was to be an unbiased test, the diet assignment was done by a computer. The process was random, and neither the volunteers nor we had any influence over who got which diet. Nonetheless, I was curious about how the volunteers felt about the 2 diets, so I asked them. If there had been an opportunity to choose one of the diets, which one would they have chosen? I expected most to say they would have chosen the ADA diet. It is familiar to most people who have been diagnosed with diabetes, and I thought the volunteers might feel a bit of trepidation about giving up meat and dairy products. As it turned out, their preferences were just the opposite. The volunteers actually preferred the vegan diet by about 2 to 1. The reason, I learned, was that many of them had already been on the ADA diet and found it dull and not very effective. Many of them had heard about the advantages of a vegan diet. Others had relatives who followed a vegetarian or vegan diet, and they wanted to give it a try. Both groups embraced their assignments, and as you have heard, some did well on the ADA diet and some did not. The results with the vegan diet, however, were powerful and consistent.